start by telling me a little bit about yourself?
Sure. So I'm a nurse practitioner here at Texas Children's Hospital Pavilion for Women in the Reproductive Endocrinology and Infertility Clinic. I'm 31 years old, new to Houston last couple of years, but I am by all means a Houstonian now.
Mm-hmm.
And I'm here with my fiancé as well.
So you guys made some big decisions. Tell me about how you decided that this was the right route for you and what you're doing exactly.
Yeah, so we went through the process of preserving fertility because we feel that we're not ready for children quite yet, but we do want them, someday. And we just made the decision to be proactive to preserve that option for us in case we need it. Hopefully we won't.
She's a little on this side. Okay, you can continue.
Okay. So just in case,
Yes.
How did you guys come to that idea, and when did you know it was the right time to do it?
So I've known about it for a while, obviously being in this field, but also we've had friends and family that have gone through fertility treatments, whether to preserve fertility or to be able to conceive. And then we just found that it was the right time for us, really because of our scheduling. We found it was a good time in our schedule to move forward, and there wasn't much of an uptake in terms of being able to proceed. We didn't have to wait long. When we were ready, we were able to jump right in.
And like you mentioned, you have a different perspective on this than many other women because you work in this field. But from your experience, is this kind of a difficult decision for people to make, or is there enough? Do they often not have enough information when it comes to making this decision?
Yeah, absolutely. I think a lot of people, the biggest thing that they struggle with in terms of being able to go through this process and to preserve fertility is, well, am I even going to use these? Am I even going to use this in the future? Is it worth me, spending this money if I don't have fertility coverage through my employer? So I think that a lot of people have that kind of hesitation about it. But I think that the majority of people that want to do it, it's easy to come in for a consult and see if it's something that would be aligned with you.
It's just that simple, talking to your doctor about
Yes.
it. You mentioned cost. What does it typically cost to have this type of procedure? Or for you, if you don't mind talking about, did you have insurance, or was it something you had to pay out of pocket for?
So I'm lucky in the sense that TCH has fertility benefits. Not all employers do. Fertility insurance is usually a separate insurance from your regular health insurance, like Blue Cross Blue Shield or United Healthcare. So it's going to be based on the employer. So it's very dependent on what a person might pay out of pocket. Thankfully I did not have to pay much.
Okay, that's good. Can you explain the process of, obviously you work here, so it was a little different for you, but maybe doing a little bit of research, determining if you want to go talk to your doctor, and then what have you gone through to get ready for, or is it a process? I have no idea. So if you could walk me through just what you had to do as a patient.
Yeah. So for my first patient appointment, I came in and I had a internal ultrasound to look at my uterus and my ovaries to kind of see what the status of my ovaries were. And then on that same day, I had a consult with the doctor to, review my ultrasound results. And then we kind of came up with a plan from there. So the plan, for the actual whole process is typically everything starts with the cycle start. You might be put on birth control pills for a couple weeks, 2 weeks or so. You might not be. And then you do injectable medications every day for about 10 to 12 days with ultrasounds every few days as well to check the progress. And when everything looks ready, you are given the go-ahead to schedule your procedure in which they extract the eggs from your body.
And what does that entail?
So
as a patient, not as a
I wish I
nurse.
could tell you. I don't remember a thing. I was asleep for the whole procedure. Don't remember a thing. No pain or anything. But you just go to sleep, you wake up, and that's it.
So you and your husband or fiance?
My fiance.
You and your fiance said, we want kids, just not right now. Do you know when you'll be ready?
We're getting there.
So-
Sorry.
So that's a little bit harder to say, right? We have an idea of when we might be ready. Obviously, we're trying to plan a wedding. I think we, want to give ourselves some time to have the freedom to travel if we want, if we, want to get a dog or something first. Those little milestones here and there. But I think taking the pressure off time-wise has made it, has given us a lot of freedom to explore our options and see what we want to do before we're ready to start our family.
I know the answer to this, but I want you to answer it for me. Do you think that this is a topic that deserves more attention? I'm a woman, and I don't recall ever having anyone sit down and say, hey, these are your options. And this is the first time I'm actually having a conversation like this. So do you, as even a nurse practitioner, is this something that we need to, as a society, talk more about?
Oh, absolutely, I do. And I think, not only for having this conversation, for all women, that kind of thing, but also, more employers are starting to offer benefits for fertility. They realize that keeping women on their team is a huge benefit to their program. So they are offering things like this for fertility preservation. I do think it's important to, even start the conversation of how do I even assess where my fertility status is, right? So that could be a conversation or a consult with a doctor to kind of see, where you're at and see if you can hold off a couple of years or if you would like to proceed immediately or, what have you.
Mm-hmm. Is there anything else, or do you have any advice for women? Well, I guess you just gave that advice, but anything more specific that you think people need to know, women need to know, that we didn't cover or talk about?
I think the biggest thing is just, knowledge is the most powerful thing that you can have. Having an idea of your general fertility health and plans is more valuable than we can put into words, especially for women that are focused on their careers, focused on themselves. You want to have the ability to start a family when you feel ready, and this is just one tool to be able to do that.
So as a 31-year-old professional who is about to get married, how does it make you feel knowing that this is an option, knowing that this is one less thing that you have to worry about, as you were just saying?
Yeah, I feel very empowered by our decision to preserve our fertility and give ourselves that option. As well, it's very comforting to know as well that we have a backup in case we need it. We hope that when we're ready to try, we won't need them at all. But it is nice to have that to fall back on.
And there was no pain or anything, no recovery time needed afterwards?
I mean, I was a little bloated for a little bit. Luckily, I timed my procedure to be right around Christmas, so everyone was feeling a little bloated at that time anyways. So, you need your stretchy pants for, maybe a couple weeks after, but really no severe pain or bloating or anything. I managed completely on ibuprofen and Tylenol at home.
Okay, good to know. And let me just make sure I asked all of the questions that I have here. Do you think that there are any misconceptions that women might have about the process of freezing eggs and harvesting them?
Yeah, I think one misconception is that it will decrease your future fertility. That is not something that we need to worry about at all. What we're doing is we're rescuing eggs that would have been discarded either way with your menstrual cycle. So we're not taking eggs from yourself in the future or anything. So if you are freezing eggs, say we get 20 eggs, that doesn't mean you're not going to have 20 eggs later on in the future. Mm-hmm. We're not decreasing your fertility by any means. And that's something that I think a lot of women are fearful of, is that if we extract too many eggs, then that will give them fertility problems in the future.
See why we need to talk about this more?
Yes.
Yeah, okay.
There isn't a question I haven't heard.
What'd you say?
There isn't a question I haven't heard.
Okay, that's a good segue. Well, what is the most important question you think you've ever heard?
Yeah, I think the most important question that I've heard is, should I do this? which is not a question that I can answer. It kind of, when I'm with a patient, it offers me the opportunity to kind of ask them, well, why do you want to? It's not that you should or should not. It's just more of seeing if it aligns with your career goals, with your family goals, with your future goals for yourself, and that being like the reason for starting.
And that gives you a really interesting kind of seat at the table, because you're going through the process and you're also talking to patients who are thinking about this. Do you think that provides, how often do you have this conversation with patients, would you say?
Multiple times a week.
Oh, wow.
So it's nice because I get to, say from the patient side as well as from the provider side, right? So it's not like, I'm a provider that's encouraging someone to do something that I wouldn't do myself. But also I can be very real and give my experience, talking about how many injections it is per day and, what those injections are like, as well as, what that process was like, what it felt like going through as well.